Okay, fine. So, welcome everyone. This is is it fifth or fourth? I can't remember now. We've got Bashir, who kindly has agreed to join us today. Um, Bashir is doing medical retina at Manchester at the moment. Um, so welcome, Bashir. Thank you very much for your time. Hopefully, it won't be long. Basically, I'm not sure if you've watched the previous ones that we've done. It's quite informal. We just want to hear from different people, their different experiences, what they found easy in their journey, what they found very difficult, that sort of thing. So could you just tell us sort of how did you begin your journey, your evidence? Was it from the UK? Was it outside hospitals? Tell us a quick summary.
So I was graduated in 2006, and I started my training in Pakistan in 2008. I did a fellowship in ophthalmology and then VR training in Pakistan for 1.5 years. In 2015, I migrated from Pakistan to UK to do my fellowship in medical retina. Um, and I was not sure I'm going to stay here in this country, to be honest. So um, and my visa was of 2 years. It's a tier 5 visa. So I did 1 year fellowship in medical retina and then in UEHS. And then in 2017, my trust offered me a specialty doctor job, which I accepted. And then in 2018, honestly speaking, I seriously started thinking about giving the exams and starting the CESR pathway. So I wasted quite a lot of my time. I must say that because I was not sure whether I will stay in this country, whether I should not stay in this country. So in this confusion, and giving the exam was a big hurdle for me. To be honest, this was the main thing. Oh, giving exams again, sitting in the part
Not
one, part
it's not
two.
easy.
Main hurdle was that. So I wasted my time. I must say that. So I started preparation for the exam in 2018, passed the exam, and then in 2021. But problem is that when I started my Caesar training in 2018, it took a lot of time for my lead and trust to give me surgeries and starting the rotation because it's a very busy hospital. Manchester Royal is second to Moorsfield. So it's starting rotations in Manchester Royal Eye Hospital. You have to be taken off from your medical retina route, which is one of the biggest department in Manchester in the eye hospital. So pros- the problem started when the COVID came and my Caesar training stopped. And because there are trainees in my hospital, there are fellows in my hospital. So they said that for 1.5 years, nothing was given to me. I was taken off from the rotations, and then I resumed my training again in 2021. I mean, last in November or December, and I've submitted my application in July, in June or July 2022. I got the reply in September 2023.
Okay, so more than a year, so 14 months roughly.
Yeah.
Okay,
Yeah.
that's a bit
On 1st
late.
September 2023, I
Yeah,
got the reply that, and with a lot of objections, a lot of objections.
great. So these are
Uh,
the things that we
but
want
I,
to hear. Yeah.
a lot of objections. I think 70, 70 objections.
Wow. Okay,
Because
that's interesting.
to be honest, what happened, because I wasted so much time in COVID, almost 2 years were wasted. And people were telling me, look, they want evidences for the last 5 years. So you better submit the application, log the evidences which you have. And in 1.5 years, when in 1 year, when they will give you a reply, you collect more evidences in the meantime.
Yeah, yeah.
That's what I did. My sir, I remember that I just did 280 cataract surgeries when I submitted my application. And I knew that I will get the objection.
Okay.
And that's what happened. They said you go to 350. And in that 1 year time, that grace period, I I tried to complete all the objections, which I knew that they will come back.
Yeah.
So that's what I did because I was running out of time.
But you do know now things have changed a bit, so they're a bit because of COVID. Probably is they've extended it a bit, so not just 5 years. There is, let's say, about 20% of your events can be within 7 years. So there is a bit of it's a bit
Okay.
easier now.
But I
That's what they
them.
say.
I called them. I asked them. They were not giving me any clear answers for that. They said we don't know. You should be within 5 years. They were saying 5 years. So I said, okay, 5 years. So I will submit my application. So I
Right.
did. That's what I did.
Yeah. And so you mentioned lots of objections. So other than cataract surgery, so can you remember what was a very sort of uh, an important objection that they mentioned to you that you had remaining from your application?
Okay,
Anything
no,
specific?
I can go to each department, each specialty. Okay, so many objections. So starting from the oculoplastics, so they wanted me to do the Botox injections, which I didn't do.
Okay.
They wanted me to do the what was yeah, so Botox injection. I remember. If you do give me a second, I will. Can I open my objections and
Oh yeah,
give
of
me a?
course, of course. Have you got it on paper? Even you can share it if you wish, or if you've got it on paper or
Yeah,
whatever,
I can.
whichever easy. Because I think that's the thing that people are looking for. So what could be missing from that application? What could be the weak points? That's the thing that people are concerned about the most.
Yeah. So I will show you what they told me to do.
But I'm really impressed that you managed to cover 70 objections in just 1 year.
Yeah, because I knew that this will come. Uh, yeah. So I have the objections in front of me now.
Yeah.
Give me seconds. Loading. Like, okay, let's recommendation one: oculoplastics at Nexa and lacrimal surgery. They wanted me to do external eye examination. CA5, one CRS required.
Right. So you haven't done that in another specialty.
Sorry,
So
I
you,
haven't done
you
that.
so you haven't done it.
No,
Okay. And they only requested one.
one, one CRS. Radiology and other neuroimaging in relation to this specialty. Two pieces of evidence which show that I am able to interpret MRI, CT scan, X-ray in a given situation, and CPDs on that.
Okay. So
Okay.
they specifically requested a CBD.
Yeah.
Okay.
Two CPDs, two
Fine.
pieces of
Fine.
lacrimal function.
Okay.
PS8 lacrimal function. So PS8 two DOPs for lacrimal function.
Okay. DOPS. Okay. Fine.
Suture removal from the eye and adnexa. That's
Again,
that.
two.
I think I may have done it, but I have not shown the evidence. But
Right. You forgot or something.
yeah,
Yeah.
I had no idea. To be honest, I didn't know how to submit. I just blindly just made the application and just submitted. So again, coming to PS15, administer periocular botulinum injections. Then uh, SS8, ocular surface protection. For ocular surface protection, SS8, two OSATs which demonstrate at least two different surgical methods to protect cornea.
So
Two
what
different.
what? Yeah. So what two procedures have you submitted at the end?
So one was conjunctival flap,
Yeah. Gunderson flap.
and
Okay.
one was the torsorrhaphy.
Okay. Right. Okay. Fine.
So I have to submit two different procedures to protect the cornea.
Yeah.
Perform lateral canthotomy and cantholysis. I was unable to find canthotomy and cantholysis because of the COVID and because the trainees are there. So the trainees take away everything.
Yes.
And I was not in the training rota, so that's why I was struggling. So that is the evidence which I produced. Uh, one from Pakistan and one from here.
Okay. So it's good that you've submitted some evidence from Pakistan. Was it recent or was it old?
Well, in the meantime I went to Pakistan
Oh, you had
and
to
did
go.
yeah, and I took some of the evidence from there,
Yeah, I had
like
to do the same. Yeah.
e-secretion and enucleations. I was struggling to get evaluation nucleation. I did it from Pakistan. I produced that from there.
Yeah. Lots of
Okay.
people have to do that, unfortunately. Okay. Yeah.
Yeah. Then in cornea, uh, I mean, it's silly. I mean, they want me to do slit lamp biomicroscopy, CA9, one CRS for slit lamp biomicroscopy. Can you believe that? Yeah, I passed FRC of the exam. I have a fellow, I did two fellowships. And still they wanted me to do the slit lamp biomicroscopy.
So can I pause you for a second? So again, I'm not sure how much you know about the process now, but the general rule is they usually require two pieces of evidence for each learning outcome. Okay, CRS is a bit of um, uh, an exception. So sometimes they only request one because you've done FRC off. Yeah, so FRC off is one of the evidence. Yeah, the other piece of evidence should be a CRS, but for DOPS and OSATs has to be two pieces of evidence, two forms, most of it
Okay.
anyway. So
Got
again, for everyone, that's the
it.
general rule. Yeah.
Okay. Then cornea and anterior segment assessment. In this, they said that two CPDs discussing clinical cases where Dr. Bashir has selected appropriate corneal investigations and interpreted it accurately, like anterior segment OCT or ultrasound, pachymetry, etc., topography. So this was the anterior segment assessment. Then in contact lenses, PM15, they wanted two pieces of evidences to attend a contact lens clinic and show evidence of attendance that clinic with a testimonial from a consultant or a senior colleague. And one CPD related to contact lenses in management of corneal diseases or correction of refractive errors or in management of complications related to contact lens wear.
Okay. Fine. That
So
should be easy. I mean,
contact,
a CBD should be easy. I mean, CBD is not that
yeah,
tricky.
yeah. Then ocular surface foreign body removal. That's they wanted one DOS for that. I have
So
done
only
so
one.
many, only one. Yeah.
That's interesting. So and you
Oh,
have not submitted another
sorry.
one. So
PS1, sorry, PS1, two jobs. Two
two
jobs.
DOPS. Yeah.
Yeah,
Okay, that makes
two jobs.
sense. Okay, fine.
Then bandage contact lens, fit a bandage contact lens, PS1 4, two jobs for that. Then corneal gluing, apply corneal glue, PS1 6, one jobs in a live patient. I did one in a course,
Yeah.
which was,
Simulation.
uh, and I was signed off for that, but I was unable to do one on a patient, so one on that.
Yeah. I mean, when you submitted, you were aware of these things that were missing, more or less.
Some of them I were aware, some I were not aware.
So did you have the curriculum in front of you and then you started ticking off the boxes, or was it random? How did you look at the curriculum? Were you aware of the curriculum at that point?
No.
You weren't. Okay,
Mm.
fine. That makes sense. Okay.
No. I was just asking from my colleagues who did CESR, and they told me do this, do this, do this. So whatever they were telling me, I was doing that. I was not sure what where to follow. To be honest, don't follow me. I was totally went blindly. And
That's fine.
my one of my colleague told me just submit it. You will get the response, and then whatever they want from you, do that thing.
That's a very sensible approach, by the way. But obviously, there's the disadvantage of it taking longer and more money and a waste of time and
Yeah.
so on. So, but yeah,
Yeah.
okay, fine.
Then there is a irrigation and debridement of ocular contaminants. PS22, two jobs for that.
Yeah,
Irrigation and debridement of ocular contaminants. Then SS8 surgical measure for okay, that's I've done. Then there was one HPD-T6 contact lens care. Two CPD signed letter on a headed paper from ophthalmologist optometrist can replace one of the CPDs. So, but I don't know what is contact lens care. They wanted me to show that I can tell the patient how to take care of the contact lenses.
yeah. So there's two sign of two outcomes there. One is for the actual contact lens for the patient, and there's another one, diagnostic contact lens care, which was a gonioscopy lens, or a laser lens or whatever. You just show in a
Yeah,
CBD
yeah,
or
yeah.
something that you can clean it properly and so on.
No,
So
this is different. I
yeah, so
show you.
that one is different.
Yeah,
Yeah.
that another one will come. Then cataract and refractive recommendation three, cataract and refractive surgery. They wanted me to do the PI 12 pyometry 2 CBDs for biometry. PM14 to use spectacle lenses and prisms when indicated.
Right. And how did you submit that? Was a CBD?
2 CBDs for that.
Okay. It's good that they're specific in what evidence they need. So they particularly mention a CBD because sometimes they can just leave it open, just a bit vague. But that's
So
good.
spectacle lenses and prisms, I thought that probably the refractive surgery, the refractive module will sign me off for that. But no, you have to produce 2 CBDs for prescription of spectacle lenses
Right. Okay.
and prisms. Then this was strange. PM16 refractive surgery. Now they wanted me to do 2 CPDs for that.
Yeah. And why did you find it weird?
That's weird because even trainees told me that they never were asked to do CPDs on refractive surgery.
Yeah.
So I have to go to the private clinic, which is held in my hospital, and I attended the refractive surgeries with my consultant,
Okay.
and that took time because it's
Yeah.
not easy because they are private patients.
Yes. So let me
You don't need
clarify
to do
things.
it, but you need to do the CPDs. You need to interpret. You need to do how to do they do the refractive surgery like any any refractive surgery.
Yeah. So let me tell you what I've done, which is much more simpler. I'm not sure who advised you to go to a particular refractive clinic. I just sat down with the cataract surgeon. There was a case about a myopic patient, high myop young girl, and she just asked about LASIK. Just asking in the clinic, like a cataract clinic, asking about LASIK. And then I just discussed with her the options, the good options, the bad options, refractive lens exchange, those sort of things. And then I had a chat with him. That's it. So
That's it.
it doesn't have to be a refractive clinic because the fact that you've mentioned that will open up a can of worms. So lots of people will sort of start sort of asking, do I need to attend the refractive clinic? Do I need to go a private practice or whatever? Definitely not. Okay, so things can be much more simpler. So you can just speak with a patient about a refractive surgery and then just write a CBD about it, and that would work as long as in the CBD you write down what you discussed with the consultant. So Bashir is aware of the LASIK indications. He's aware of the side effects of refractive lens exchange or whatever, and that should be counted. Yeah.
Okay.
Okay.
Okay. In details, I think they no, yeah. So that yeah, you're right. I think I
Yeah.
uh
I think you made it much more complex.
you're right,
Yeah.
possibly. But I think I remember that when I would they this is just the summary. If you go to details, they specifically asked about which refractive surgery they want. And I did that. Anyway, I did that.
Fine.
Um, then it was a refractive assessment and provide optical prescription in adult and child.
Okay.
That is yes, two CRS, one on adult, one on child. So
CRS
refractive
or
assessment,
CBD? CBD.
CRS, two CRS.
Which CRS was that? Was it
Perform refractive assessment and provide an optical prescription. That was weird, but because I think I couldn't find any CRS on that,
or was
but I
that
did it.
that's not retinoscopy, is it?
Sorry?
Retinoscopy, that's a different it's a
Yeah, yeah, yeah,
different DOPS.
yeah, 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 retinoscopy.
Retinoscopy. Okay, fine.
Yeah.
Okay. Did they
And
specifically ask one retinoscopy for one adult and one child, or did they sort of okay,
yeah,
fine.
just said that.
Can
Then
I
in
pose you? There's
cataract,
a question. Can I pose you for a question if you don't mind? There's
yeah,
someone, Surendra. You've got your hand up.
Yes. Thank you, Mustafa and Bashir. Before we proceed, and I forget, I can I quickly ask a question? You said with regard to these refractive things, you discussed a case of myopia with your consultant.
That
yeah.
was me. Yes. Yeah.
Yes. So does that need to be a corneal consultant, or can we do that with any cataract consultant?
Okay, let me tell you
Thank
my side of things, and then Bashir can add. I'm pretty sure that any CBD can be signed off by any consultant. Okay, even a neuro consultant, a PEDS consultant, whichever, as long as they're a consultant. Okay, and then it's a good discussion about whichever topic it is. Bashir, would you agree? What do you think?
Yeah, yeah, yeah. I'm fortunate because in my hospital every specialty is available. Cornea is available, and even evening clinics and private clinics. So I did with the corneal consultant.
Yeah, so
Yes.
you're lucky.
Right.
You're looking in
Thank you
Manchester,
very much.
but in other units they don't. They are definitely don't have refractive surgery. So okay, Salim, you've got your hand up. Salim, Salim Afridi. Are, are you able to unmute yourself? No.
Sorry. Hello. Can you hear me?
Yes, we can. Yeah.
I thank you both for your good discussion. So I just wanted to ask Bilal that
Yeah.
for the adult and child refraction. So
Yes.
what exactly? So do we need to go and attend a refraction clinic and just refract an adult and a child and get it signed from the optometrist, or how do we produce the evidence? Well,
So you need to perform the retinoscopy in front of. I did it in front of my consultant, pediatric ophthalmologist,
okay.
and he just signed me off for that.
would uh, uh, would an optometrist can an optometrist sign it off, because not in every
He
clinic a consultant is available to observe you for refraction. Sometimes they are busy.
So I for CRS, I think it is a consultant who has to sign you off.
It has to be a consultant.
Yeah.
Yeah.
Okay.
Well, look, if you go to
You
pediatric
see,
clinic, they
yeah.
usually do retinoscopy. I've seen. I mean, I've attended. They
Not
usually
no,
do the
I think you are privileged to work in Manchester, right? Not in every hospital, and not every consultant will come and observe you for retinoscopy. It sometimes can be difficult in some units. Manchester Eye is a very big hospital, and you
Then
may get a chance.
see, then there are some optometrists in my hospital. They were even Royal College portfolio. They can sign you off. They were very senior.
Exactly. Okay.
If they can do it, yes, why not?
Like contact lens clinics,
Yes,
some
yes,
sign offs, and
yeah, I did
the
it from.
consultant doesn't sign you off. It's a contact lens practitioner who signs you off, isn't it?
Yes, of course, that's Optom. Yeah, I did it from that. Yeah, and
Okay. Yes.
that Optom was on the Royal College. I mean, assessment. He was assessor.
Assessment. I was an assessor. As long as
Yeah,
the person is an assessor, then it should be fine.
yeah, yeah, yeah.
Let me add
Okay.
some extra points. So, to my knowledge, the only thing that has to be signed off by a consultant is a CBD. Okay, so
Okay.
CBD has to be a consultant. Anything else, it depends on that person. So, let's say a retinoscopy, definitely, but you have to write a senior optom. It doesn't make sense if they're junior, it won't be enough. So, just write a senior optom. They can sign it off, and a nurse can sign off an irrigation. A nurse can sign
Exactly.
off a Botox injection or whatever. Uh, Trainees, again, ST, let's say 3 or 4 and above, they can sign
Yeah.
off stuff. So you have to be sensible on what that person can sign off. Are they senior enough? Are they competent enough?
Yeah.
And it will work. Okay. Um,
And
So if
Mustafa,
you
did you say as CBDs are only to be signed off by consultants? So
yes, that's what I understand. That's what people have been doing, and I think that's the case. So, but the
yeah,
question is, does it have to be a permanent consultant? Can it be a locum consultant? There's
yeah.
a bit of
Gray,
controversy in
gray.
this.
Yeah, yeah, yeah.
I would suggest making your most of your application by obviously permanent consultants. Unfortunately,
Senior.
some units do not have permanent consultants at all,
Yeah.
maybe one or two. So that will be a struggle. But in that case, if you are stuck in that place and you cannot move, then you just sign off from local consultants and write somewhere what the team is that you don't have like a cover letter or something explaining that you don't have permanent consultants in your unit. Yeah.
Got it. Yeah.
Um,
Things like low vision aid consultant, they're not there. It's the low vision aid person who signs you off, isn't it?
exactly, exactly.
Yeah.
Some other consultants are quite flexible, so they tell you something like, "Okay, please attend with the nurse next door who's doing the biometry, for example, and
Yeah.
then they will see you, and then later on I'll speak with them, and then if they're happy, I'm happy to sign you off in my name."
Perfect.
So
Got you.
there
Yeah.
is flexibility. Yeah.
can I
Thanks.
add something, Salim
Yeah.
bhai? Can I
Yeah.
just
Please.
tell you one thing?
Sure.
What I used to do, that if this is written PS2, you write down PS2 on Google and write down RC opt. The page will open which will tell you what PS2 code, and then add. If you see the table, they have
Yeah.
written
Yeah.
the assessor. they have written the assessor there. Like for PS2, they have written consultant ophthalmologist, senior OST,
Yeah.
okay, and optometrist.
Got you. Okay, that makes it
Yeah.
easier
So
for you. There
so
you can.
don't worry if you have any problem. You go to Royal College website or just write on whatever PS2, PM14, and then just see what the Royal College says. Whatever the Royal
Yeah.
College says, you can sign it from these people. It's
Got you.
written very clearly.
Yeah. Yeah. Thanks for that. Thank you, Bilal.
And
Thank you.
Yeah.
again,
Uh,
because now things are a bit more complex with 14 fish and stuff. So remember that all of your CESR pathway or your portfolio pathway, you don't have to do it electronically. Obviously, the old portfolio is now closed. So that person does not necessarily have to be on the list of assessors. Okay. So because
Really?
now, yeah, because some people now are not doing it on the portfolio pathway, on the online portfolio. So they are
Yeah.
doing everything on paper. So
Paper.
all you need to do is just get them to sign it and then write down what their level is, so senior optum or whatever.
Yeah.
If you're not sure, then maybe get a letter from the consultant saying that they've joined this senior person. They're happy that they can do this sort of technique or whatever, like a testimonial letter, just to add your evidence if you're not sure. But
Yeah. Yeah.
definitely,
Yeah.
it doesn't have to be that this person is actually on the list of assessors. Okay, that's something that actually I've more or less recently learned. Okay.
So get almost everything signed off on a hard copy, piece of paper, and then
Yeah, if
collect
you
that.
wish,
Right?
and then you can scan it.
Yeah.
Yeah,
Yeah.
that's
Okay.
another option.
Okay.
Okay.
And then you should also do some related outcomes with these all of these sign offs. I mean, that's very important because then it saves so much time and you don't need to do all these competencies again. There are related outcomes with each of these competencies. So
Yeah,
that what I didn't do in my first submission, but in second, it helped me a lot.
yeah.
Okay.
Associating the outcomes very important.
Yeah. Yeah.
Okay.
Association. And it is
Associating
written in the
outcomes.
same it is written in the same page where like if you write on PS2, you will see the related outcome of PS2. So you don't need to do PM14 or PM, like the related outcome of PS2 is PM14, PM15, PM16, and PCS6.
Okay.
You're
Hmm.
signed off for all this.
I would
Okay.
recommend maximum three outcomes. Okay, so associate only three outcomes with each form. They were very clear about that. Okay.
Three
Yeah.
outcomes. Okay.
Yeah,
Three
maximum.
outcomes. Thank you.
Okay. Ahmad Fuad, you've got your hand up.
Yes, you mentioned that we can go for any consultant for CBD. You know, sometimes they are not all cooperative, or they are not all uh,
I'm
happy
sure
to
everyone agrees. Yeah.
support.
Yeah,
Yeah.
yeah.
So you can I go to only one or two consultants to sign me off like different subspecialties?
How many consultants have you got? I mean, it's a very variable
Well,
question. So
I have only three consultants that are happy to help out of six.
there's no other way out of it, is there?
Yeah.
I think you just have to do it and see what happens. But I would recommend somewhere um, to mention that the unit is only composed of six consultants. So just that the assessor knows that you just have to use only these three.
Mm.
Um, you don't write somewhere that the other consultants were not flexible or not happy. Do not write this in public, but you just say something like the unit is only six consultants. It's a small unit, so I think that will be fine. I guess hopefully.
Yeah. Thank you.
Yeah. Okay. Bashir, can you carry on? Is there any other after
Yeah.
refractive? I think you've started
So
refractive.
we were in the recommendation three cataract and refractive surgery. And then it came to the cataract surgery. Again, I told you I just did 280 surgeries at that time. So they asked me to complete 350 cases. And they asked me to do sign two EPA 1 forms, EPA 1 forms. One EPA form could be replaced with a signed testimonial from a senior colleague or consultant stating specifically that all the relevant skills as outlined in the EPA form are met. So the EPA form for that they wanted me to do two OSAT and evidence of ability to undertake an entire cataract list by submitting the forms.
So let me again clarify to people what the EPA is. EPA is Entrustable Professional Activities. Now, for those who are doing the new pathway, it's a bit different. So EPA is like the summary form of that specialty. It's like a clinical supervisor report sort of thing. That's different. So now we're talking about the old CESR sort of pathway. EPA is like it's a managing a cataract list. Okay, so it's a form you fill up, consultant signs it, mentioning the cases that you've done independently. And obviously, ideally, it should be complex cases, and then they sign that happy doing this on your own. Bashir had to submit two. I submitted only one, and then the other sort of piece of evidence, as he said, maybe just a letter from that consultant or someone else mentioning that you can, independently do lists, or you're a competent cataract surgeon, complex cases, you train juniors, and I've submitted an actual list, just a copy of this, obviously removing the patient details, and with my name on top. So surgeon, Mr. Dawidor or whatever, and then the list proving that you can operate on your own. Yeah. Okay.
This comes to end now. Recommendation 4, that is glaucoma. And in glaucoma, they wanted me to do CA8 IOP measurement. 1 CRS for that.
Okay.
Like with applanation tonometry. Then PI 13 visual fields. And they said to do 1 CPD demonstrating the ability to select, order, and interpret automated and manual visual fields.
A CBD. Okay, fine.
Yeah. Then visual standards. PM1, PM10. PM10, they wanted me to do 2 CPDs for visual standards. Support and certification of the visually impaired patients. PM11, 1 CPT in relation to completion of a CVI form. Then SS5, that is 2 OSATs showing ability to perform 2 types of IOP lowering surgical procedures, including trabeculectomy, cyclodiode, or bleb needling.
And which ones have you submitted at the end?
So I did 1 bleb needling and 1 cyclodiode.
Okay, I think that's not all consultants are happy for juniors to do needling, but for me, because back then I was still training, I only assisted in a trap, and I got that signed off. So you should be clear on what you've done in the surgery, but it's a bit flexible, I think. I'm not sure the new curriculum, how flexible they are in this sort of thing, if it's level 3 glaucoma. But ideally, you should submit some sort of surgical procedure. Lasers will not be enough. So lasers are the 40 lasers, so PI and SLT, that's different. But OSATs wise, you have to do some sort of surgical thing in theater. Yeah. Salim, you've got your hand up.
Yes, my question was exactly, I think you've partly answered it. I spoke to my glaucoma consultant recently that the Royal College is asking to be performed by the trainee trabeculectomies or glaucoma surgeries. He replied that no, not even STs we allow to do trabeculectomies even in their 7 years tenure. So you're not supposed to. And then I argued that well, they are asking about, so how do we do? And he was still reluctant. So what do we do then?
Cyclodiode. Do
No,
cyclodiode.
trabeculectomy specifically.
You
Because
don't have to specifically do the trap, okay? So not specifically, but cyclodiode is a good option. It should be easy to do, safe.
How many?
2
Two
IOP
forms. Yeah, so 2 forms. You need 2 OSATs for any surgical procedure, plus obviously the logbook, the actual surgical logbook. You have to, but this is very clear that it's only lasers. Okay, so in the logbook, you have to just submit lasers, but as a form, has to be in theater. So something in theater that you've done. As I've said, if you're doing a trab or assisting in a trab, which I've done, it was fine. And I've written something like, he's taken steps in, maybe doing an initial flap or something, or closing the conj, or he's aware of these techniques. Something to show
some sort of involvement.
You've assisted. You've attended. You've assisted. You don't have to do the operation from A to Z. Yeah.
Okay, so what you're saying is that doing two cyclodiode and then the rest of the lasers and assisting in any sort of IOP lowering procedure will do.
I
Is
think
that
that would work. Yeah, I think that would work. Obviously, there's again a debate about MIGS. So would doing a fake eye stent be considered? I doubt it, to be honest. I mean, MIGS is not considered as a filtering procedure or a proper glaucoma surgery. So it's a bit debatable. Yeah,
and
I would
and
suggest.
YAG PIs, which we do for narrow angles or angle closures, that will be counted in laser procedures. Uh,
So in the
SLTs and YAG PIs, SLTs and YAG PIs,
yeah, in the
both.
logbook, yeah. So in the logbook and the late
Yeah.
glaucoma procedures, so PIs and SLTs. Yeah, definitely.
No, in the 40 procedure that they have asked for,
Yeah.
that will be a combination of lasers,
Yes.
mostly lasers, obviously, because and then just a few surgical, like a couple of cyclodiodes at least.
Yes.
Is that what you? Okay,
Yes.
got you.
I'm not
Thank you.
convinced why they request SLT, to be honest. I mean, SLT is not a general ophthalmologist sort of thing, you know. Only glaucoma specialists should be doing SLT. But PI definitely because, you know, you can be faced off with angle closure and you have to do it on
Yeah,
the days on call. So that's fine. But I'm not sure why SLT is a thing. So I think my gut feeling is if majority of your logbook is PIs and a few are SLTs, that's fine, I guess. But
mhm.
let's agree that it's very variable. Again, what went well for Bashir might not be okay for me and vice versa, depending on the assessor and depending on your application, you know. So
Yeah.
there are lots of variability.
Yeah, because I don't think they are going to give us, even if you are capable of doing it, a full trabeculectomy procedure. They are not. At least my consultant was not in the mood to give me a trab. Anyway, I'm not saying I'm a trab expert, but for the purpose of Caesar, anyway, he was reluctant.
Yeah, yeah, I'm sure. I'm sure.
Okay, all right, thank you,
I
thanks.
want to just inform you, Salim, that
Mm.
the surgical procedure should be two different type. So if you remember, I came to your trust for the glaucoma rotation.
I remember, yeah,
Yeah,
Mr.
and
Agarwal, yes,
I did KDB goniotomy there. So I
yes,
submitted KDB goniotomy, two KDB goniotomies as a surgical procedure, but they accepted one, and they said you should do one different type of
a different
surgical
one.
procedure.
Okay, yes, yeah.
So then they mentioned you should do either trabeculectomy or bleb needling or cyclodiode. So I did two. I did bleb needling and cyclodiode. So I did two more.
Yeah.
So I would suggest that you should do either a cyclodiode and
Yes,
bleb needling. I think there should not be any problem in bleb needling. The bleb
needling.
needling is very commonly performed,
Yeah,
and they
yeah.
can do it.
I
It's
agree.
very easy. I mean, the supervisor should give you that.
Yeah, I think it should be all right. I think it should be all right. It was just a trabeculectomy that he was reluctant.
No, no, no. Don't
But
do
yeah, thank you,
trabeculectomy. Don't do trabeculectomy.
thank you. Yeah, got you.
And
Thanks.
definitely not the whole case. Okay, so doing some steps should be fine, and
Should be
just
fine.
it just depends on what you write in the form, you know. And if the consultant is flexible and they like you, they'll be fine. Yeah, but if they don't like you, that's going to be an issue. So,
Okay,
okay,
thanks. Yeah,
fine.
thanks.
Okay, what's after glaucoma or anything
Okay,
else?
now it's recommendation 5. It's retina and vitreous uvea. So strange fundus examination. CA10. They
So
wanted me to do
again, sorry, Bashir. So can I just
CA10
pause you?
one CRS for that.
Yeah. So see how Bashir is very annoyed by, you know, I'm very senior, you know, I've done my exam. How could
Yeah,
they ask me for a fundus exam? Which is
yeah,
ridiculous, isn't it? Yeah.
yeah, yeah.
For trainees, that's different. Trainee is a trainee, they're still learning. Yeah. But for us, we're very senior, we're done with our training elsewhere or in the UK. It just doesn't make sense. Yeah. But that proves to you that all of this thing is just a tick box exercise. Okay.
Yeah.
It's just paperwork. It's not about how good you are in doing fundoscopy. Okay. If you are a VR consultant doing indirect fundoscopies every day, you're not going to get accepted without that form. Okay.
Yeah.
Similar
Very well.
to, let's say, B scan. You know, again, one of the other locum consultants told me that, you know, she's teaching juniors how to do, you know, and and she's a VR consultant, and they still requested her, to just submit one more DOPS of a B scan or whatever. Doesn't make sense, but that's what the game is. So you have to play their game. Okay, that would be my advice. Do not,
Yeah.
do not try and think how to have
Yeah,
shortcuts or
my fault. I presume that how can they ask me to do this because I have done fellowships in medical retina, do every day this.
yeah.
But then it came back. It came back, and even the exams don't sign you off for all of this. You need to do one CRS for fundus examination. Then the second one was CA11, general medical examination. Now this was bit I was struggled. CA11, a letter from a consultant physician,
Okay.
or a senior colleague observing Dr. Bashir can perform a general medical examination covering all areas relevant to ophthalmology.
Okay. So what did you do about that?
So, fortunately, in my trust, there is one of the consultant who is actually a medical specialist,
Okay.
and she is doing a uveitis clinic. She is the lead of uveitis.
Yeah.
So she's actually a physician who has done medical ophthalmology. So I went to her, and she then took me to the ward, and she asked me to do the full examination, and then she signed me off for that.
That's good. Again, let me tell you my sort of experience. I have, again, for some reason you've made it very complex. I kept it much more simpler than that. Yeah, I think what mine sort of was a CBD about a case. I think it was thyroid, or it was a neuro, I think, case or something. So anything that is related to general medicine with ophthalmic signs, and I just check their pulse or check their heart rate or whatever, and then it's all about discussing what are the relations. Yeah, so Mustafa's aware of the diabetic sort of changes in the eye and how could that affect the body, or vice versa. Anything general medicine related to the eye, that should work. But as long as you write down some things, and the same goes for neuro examination, and I think pediatric and developmental examination. There's CA 12 and
Yeah,
13, I believe.
yeah.
So
Yeah,
these three are the same. Yeah. So they haven't got a CRS form for on their own, like the other stuff. But you can just do a CBD on them and then associate it to them, and that will work. So I think just keep it simple. I think that's not a big deal. That's not, we never do a general medical
Well, I was
examination.
a bit surprised from this comment that letter from consultant physician. That's
It's too
why I said,
much. It's too much. The
why
problem
is
is
it?
that the problem is that now you're forced to do that. So that's the recommendations. You have to do it.
Yeah,
If it was
I
from the
have no
beginning,
choice.
yeah,
What they have written, I have to follow like letter and spirit.
exactly. Because you're
Yeah.
at risk if you don't follow what they write down, then you have to do everything from the start. So that's an issue. But for other situations, I think just keep it sort of more simple. I think Salim, you've got your hand up.
Yes, I think again you have partly sort of answered the question. So it does not have to be a physician necessarily. So you can discuss a medical retina case, for example, diabetic retinopathy, hypertensive, with your uh, ophthalmologist consultant, and that should do for this one.
That worked for me. Okay, maybe other assessors, because remember, there are two assessors. So
Yeah.
my assessors were very nice. So
Okay.
maybe Bashir's assessors were very tough. I don't know, but it will vary. I think as long as you write down um, medical stuff,
Yeah.
Salim is aware of the association of diabetes to the eye, or he's aware of how to do a basic medical examination, or maybe which we've seen a lot in our clinics, a patient who collapsed. Let's say you've went to that patient and assessed their status, that you've checked their blood pressure, you've done CPR. If you can get a testimonial for that, I think that would be fine.
Yeah, Bilal, when you went to the physician to fulfill your requirement, did it involve things like cranial nerve examination? Because that is a very basic
Well,
medical.
no,
Yes.
not cranial nerves. All others, general physical examination, the examination of the abdomen,
Okay.
just auscultation, like things like that.
Okay.
She
All
was
right.
very
Good.
strict. She wanted me to do everything like general. she didn't sign me off. I failed one time and she was not satisfied. She wanted me to do again. I did again in front of her. Then she passed me.
Repeated. Okay. All right. Thanks.
Yeah, the cranial
So
nerves would work for a neuro exam, so that
yeah,
was
that I
CA12,
did.
I think.
Yeah,
11, can't remember.
I think there are a lot of. I think I will quickly go now because then they came the neurological examination. CA13, a letter typed from a hospital headed paper from a consultant to observe the performance of a neurological examination, emphasis on cranial nerves. So that's another one which I did, CA13. Then visual fields, again, that I've done already. Recommendation 7, pediatric and ophthalmology and strabismus. CA7, perform cover and uncover test, ocular motility testing, 1 CRS for that. Then CA12, pediatric and developmental examination of child. CA112, CA12, 1 CPD for that.
Okay.
Or a sign letter from the consultant showing the feedback from a colleague or consultant that Dr. Bashir, basic pediatric and developmental examination technique is satisfactory.
Yeah, more or less the same concept, just a
Uh,
general quick exam, that's what worked for me anyway.
yeah.
Sorry, Bashir, can I get Aziz to, again, he's got his hand up, Aziz Dawood.
Yes, hi guys. I would like to ask how many CRS for the general medical and the neurology? It's just
One,
one CRS or two for each?
one, one.
Just one.
Not CRS is a letter
CBD.
type
Yeah, it's a
CPD.
CBD or a letter. Yeah, because 11, 12, and 13, I don't believe there is a CRS for it. Yeah, so a CBD or a letter, as Bashir was saying.
Yeah, yeah. Just take a letter from the.
Yeah.
Okay, then force duction test, PS24, two DOPs to show the force duction test. Then IOP, sorry, the HPDP1, promote the value and assist and organization of a screening for eye disease like ROP screening or diabetic retinopathy screening. So I have to produce. Although I did the ROP check on 10 patients, but this wanted how you do the screening procedures. So I did one from the diabetic team, the screening, and another from the pediatric team, the ROP screening. The letter, I just took a letter from them. I already did that, so they just give me the letter. I didn't went specifically for this.
Fine.
Then general ophthalmology, paracentesis. They wanted me to do that's PS9. And in PS9, they wanted me to do two DOPs that I can do anterior chamber paracentesis for diagnostic or therapeutic purposes.
Did they
Okay.
specifically ask it to be an urgent one, like a post IV injection spike or something? Does it have to be urgent, or
No, no, no. So
what
I
did you
did no.
submit?
I submitted it in my cataract surgery.
Okay, that's
Impressive.
that's
I
really
just
reassuring.
yeah.
That's good.
Then they accepted it. Blood test. Uh, PI 9. PI09, one CPD that Dr. Bashir can select, order, interpret appropriate blood test, and recognize when further action is needed in clinical scenario that is not same as bilateral uveitis, things like that. So, or sarcoidosis. So, blood test that you can order blood test. It can be a diabetic patient. You can order any blood test, full blood count. You do emergency, so that can be. Then histopathology. PI10, and they wanted me to do one CPD to show the ability to interpret the results of a histopathology report, explain to the patient, and plan a management plan appropriately based on the histopathology results.
Mhm.
So that I did in oculoplastics clinic by 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 discussing the histopathology report for the squamous cell carcinoma. Then microbiology, uh, PI11, one CPT that they are able to interpret microbiology results, explain about the causative organism to the patient, and plan a management plan appropriately based on the microbiology results, including appropriate choice of antibiotic.
Mhm.
Then came the immunology. And immunology, they wanted me to do two CPTs for immunology. Then came the bone scans, And in bone scan, like you can do DEXA scan, or you can discuss these things. Okay. Then PM2 prioritizing PM. So just a minute. PM2, yeah. So PM2, they wanted me two CPDs or one CPD, one multi MSF that shows Dr. Bashir can recognize when a patient clinical presentation needs priority, and then they can make appropriate arrangements to expedite their care. So you can,
CBDs, so all
yeah,
CBDs would
CPD,
work.
yeah, prioritization. Then came the systemic implications, PM13, which is two CPDs that they can recognize when a patient ocular problem is a manifestation of a systemic disorder.
Yeah.
Okay. Then came the diet and nutrition, PM18. Two CPDs to show that they can recognize when a patient ocular problem is a manifestation of a dietary problem.
Yeah. What sort of example did you submit there? Do you remember?
So I think this was one patient who had malabsorption syndrome, and as a result of malabsorption, he had vitamin A deficient, and
Okay.
the vitamin A deficiency was causing corneal problems.
Fine. Okay.
And I think there was another dietary. So dietary. So there was another CBD I discussed about the diabetic patient who was not taking his diet properly. Oh no,
Yeah.
no, yeah, yeah, that's the one. I think I
Yeah.
remember. Yeah,
Mine
so
was a AMD patient, and I then discussed the ARIDS sort of formula and the nutrition and taking the vitamins and stuff like that. So lots of
yeah.
examples. Another one is nutritional optic atrophy, again, optic neuropathy. That's another one. Lots of ideas. Yeah. Okay. Fine.
Then prevention of eye injury, HPDP4. And in HPDP4, they wanted two CPDs discussing a patient regarding the use of protective eyewear and eye injury prevention.
Okay.
Okay. Then disease risk reduction, HPDP5, two CPDs that they can implement to show that they can implement risk reduction strategies relating to ophthalmic and relevant systemic diseases and their treatments.
Yeah. Obviously,
So
all of
that,
these recommendations are a copy paste from the curriculum. Okay, so they just went to the curriculum on the website and then copy pasted what is required from that trainee or applicant to prove that sort of outcome. Yeah, so if obviously if you're not following everything he's saying, all of this will be on the curriculum. Yeah, so his only mistake in this is that he wasn't aware of these outcomes that are needed. So if you are aware of them, it should be easier, hopefully. Yeah.
yeah. HPDP8, avoidance of allergens.
Yeah.
Two CPDs discussing with a patient that an allergic eye disease requiring advice on avoidance of allergens. One CPD can be submitted by a letter confirming attendance at an allergy clinic.
Okay.
Then HPDP9, promote of immunization. And in HPDP9, two CPDs you should submit. One CPD can be substituted by Dr. Bashir's own immunization status like COVID-19 vaccination.
Okay, that's easy. Okay.
Okay. Then HPDP10, test and drugs in pregnancy. And they wanted me to do two CPDs for that. What test and drugs which you can tell the patient you should avoid during
Yeah. In
pregnancy.
glaucoma, for example, glaucoma drops or something. Okay, fine.
Yeah. Now recommendation 9, CPD continue. So they wanted me to do, Dr. Bashir should submit a CPD diary or alternative evidence showing a CPD points accumulated over the 4 years in categories A, B, and C, and notes and reflection what was learned.
So what did you about that? Did you submit a whole diary of CPD points? Okay.
In the previous e-portfolio, in the pathway, in our, there was a diary, so I submitted everything.
Yeah.
Yeah.
Just the certificates after each other.
No, there are categories there. A, B,
Yeah.
and C. In the previous one, there were categories. So in each category you have to add.
Yeah. So did you specifically abide by these? I mean, did you mention specifically these were external, these were internal,
Yeah,
and
absolutely. External and internal, absolutely. I did like that. This
okay,
time I didn't do any mistake. Anything
right?
which they said,
You learned
I
your
followed
lesson,
like that.
right?
Accommodation, then recommendation 10 audit. Now, this was a bit strange for me, but Dr. Bashir should submit 2 audits in subspecialty that not already covered, which was medical retina. Okay. So 2 audits in different specialty. The evidence should provide is an audit report, presentation, and audit certificates. And they also want me to do one re-audit, one
Full
re-audit,
cycle, full cycle.
full cycle. Yeah.
What was the full cycle that you submit? What was your audit?
So actually, it was an audit done by someone else, and
Mhm.
I did the re-audit of that audit.
Yeah. So again, a very important point. So again, for people, you don't have to do the whole audit yourself. Okay.
Yeah,
Even the full cycle, you don't have to
yeah,
do it from A to Z. You just do the audit. They just want to know that you're aware of the full cycle sort of thing.
yeah, yeah. So that's what I saved my time by not doing the full audit cycle. I just did the re-audit of the already done audit.
Okay. Fine.
Yeah. Then the audit is done. Then the last one is recommendation 11, clinical governance. Dr. Bashir should submit 3 sets of meeting minutes
Yes. That
where
you've
they have
attended.
attended and participated actively.
Fine. Aziz, you've got your hand up.
Yes, hello. Yeah, I would like to ask a question.
Yeah.
In my department, I'm doing a lot of CAS, and in the CAS right now, it's become like a general clinic because the department has some closure and we reduce the capacity. So let's say on Friday, I did 3 things, okay, 3 different things. Could I submit 3 DOPs on same day, or I should just submit 1 DOPs or 1 CBD, or how it work? Because I hear that you should just submit 1 DOPs from each day. What's your recommendation?
What do you think, Bashir? I mean,
I
he's
don't.
talking about bunching. So have you bunched evidence? Do you remember submitting 2 pieces of evidence on the same day
Yeah.
and it worked?
Yeah.
How often? I mean, is it a lot in your
I think
application?
in 1 or 2 occasions I've done that.
Yeah. So it's not a big deal, but obviously do not overdo it. You know,
In eye emergency, I think I've done 1 or 2 on the same day.
yeah,
Yeah.
because people now
It's,
are
if it is signed by a different consultant, 2 different consultants, 2 different competencies,
Yeah, yeah,
then
yeah.
there
Let's
should
say
not be
on a
any
Friday,
problem.
yeah, I have a lid closure suture removal, let's say post lid reconstruction. So this is a nice one. And I have ordered an incisional biopsy for basal cell carcinoma. So this is not a very common. Yeah, you sometimes you need it. So you
I want
couldn't say
to add one more. I remember that one of my it was rejected. That was a temporal artery biopsy. So what I did 2 temporal biopsies of the same eye, right eye, on the same day, and the assessor signed me off for that. They accepted one, they rejected the other one,
so
and
what did you do? What did you submit to?
two
The
two
same patient
temporal on different patients,
on the same day.
but on the same day. But they said because it is the same eye and the same day, so we are rejecting one. You should produce another one. So I did another one then.
Yeah, the whole point is that they need some time for you to improve your technique and reflect on what's wrong and missing, and then you can submit another one to improve yourself. It's not a big deal. Occasionally, things that are very rare show up in the same day. I don't think it's going to be a big deal, but do not repeat it, because it will show us bunching. They don't like bunching in the college. Yeah, so try to separate your evidence as much as you can. Okay. What
okay,
else?
thank you.
And anything else? And your recommendations?
That's enough.
That's enough. So that's very good, actually. I mean, because that's the most important thing. People want to know what was missing in your application, and that is a very good proof that Bashir was not aware of the whole curriculum, and still, they came back with recommendations, and he's done them, and it was fine at the end. So this is a reassuring things and encouraging things for people who are very lost, people who are not aware of the curriculum. But now it's not an excuse. Okay, when he submitted 22, you mentioned that was more
22.
tricky. So that was more
Yeah.
tricky because not everyone, is aware of CESR and
No, I was not
um,
aware.
Yeah, so now there is no excuse. Okay, we're doing these sessions. There is lots of training days at the college. There is lots of support, and everything is online, and the groups on
Yeah.
WhatsApp. So everything is there. So do not just know things and try and get it first go, first on first go as much as you can. Will save you time. Salim.
Yes, I have questions. So, when you are collecting the numbers for various subspecialties like glaucoma, cornea, medical retina, does it have to be specifically in that subspecialty clinic, the patient that you collect? Or I'll give you an example. So I'm doing a casualty clinic and I see a mix and match of everything: glaucoma, cornea, VR, medical retina. So from there, can I collect those patients for my subspecialties?
Yeah.
Did
Why
you
not?
get my question? Sorry.
Yes, I got. So you mean that there is no time restriction. You can
No,
collect everything. You
it's not
can
about the
collect it.
time. It's about the subspecialty. Do I need
Yeah.
to?
Fine.
It's
Yeah,
fine.
I
It
understand what
doesn't
you
matter.
mean. Like if you are in rotating in cornea, can you collect the evidence from glaucoma? Yeah, why not?
Yes, absolutely. That's my question. So you can, any cornea patient from any clinic, you can collect it.
Yes,
Because
definitely. Yeah.
some of the clinics, as you may be aware, in some house are just general ophthalmology clinics, or casualty is is a mix and match. You get
Can I
everything
can
there.
I tell you one thing? You
Yeah.
know, when I got this objection, can you see how many objections I got?
Yeah. Uh-huh.
70 plus 2. My lead was not willing to give me another rotation in all these departments.
Okay. Yeah.
So
Yeah.
what
Yeah.
they told me, you stay in medical retina. We are
And
very busy. We cannot relieve you.
yeah.
Whatever you want to do in your SPA sessions.
Okay. Mm-hmm.
So I did all this in 4 months, 5 months in my SPA sessions. Can you believe that? And I
Mm-hmm. Mm-hmm.
do the on-call shifts and evening shifts, and you don't understand. I did the emergencies, and I did everything in these days. In this, there was no
And
rotation for me. In second go, it was every specialty had so many objections.
yeah.
So in
Yeah.
SPA sessions, I did everything.
So you collected the data from wherever you could, basically.
Yeah.
Yeah. Okay. Got
In
Very
it. Got it.
fact,
good.
sometimes between the lunchtime, I go out and went to another clinic and
Yeah.
do this competencies and came back to my clinic.
But it was
Got it.
worth it in the end. Do you agree? It is worth it.
Yeah.
Yeah.
Mhm.
Yeah.
I finished the clinic earlier, went to another clinic. I had a discuss like there was a one on the bone DEXA scan. So uveitis clinic was going on, and I remember I left my clinic, finished the clinic earlier. I went to the uveitis clinic, discussed the DEXA scan with the consultant, came back to clinic in afternoon. I started my another clinic. So
Mhm.
no, it's nothing like that. You
There is no
just
hard and fast rule. There is no hard and
no.
fast rule. Wherever you can collect, whenever you can collect.
Yeah.
Yeah.
It's just like a computer. You put the evidences in box, and then the computer
Yeah.
will sign it off. That's
Yeah.
fine. They will not see the timing and rotation. I
Mhm.
don't think so.
GA have got their hand up. Not sure what's GA
Hello.
stands
Yes,
for.
I'm Gayatri. Sorry,
Hi,
Mustafa
Gayatri.
and
Hi.
Bilal. Yes, thank you very much for this very helpful discussion. I just wanted to give an input anyway. So, on the last portfolio pathway training day, which I attended which was held by the college, they mentioned something about audit. So I thought it'll be helpful to the others as well. So the previous rule, which was there actually to cover the audit should cover all the subspecialty. It should be from different subspecialties. It's not more there anymore. So it
Yeah.
can be from one subspecialty.
Yeah.
So and
And
it
because
is
I
within.
got the recommendation, so I got a recommendation that you should do in the
Yeah.
different subspecialty that they mentioned. So I
So
have
you're
to
Yeah.
stuck.
follow what you
You're
said.
stuck. You have to follow it. Yeah.
That was previously actually. Now it is not no more there. So it
Well,
is.
It is
Yeah. So
flexible.
it's
I think now
flexible
it's
now.
flexible.
And
And remember that it depends on your application. So let's say that his application was perfect, no mistake whatsoever. I think they'll be fine. I think they would have come back say, okay, just ignore the audit. He's fine. Let's give him decision. Yeah. So I think if but he's got like 70 recommendations. So that's why they just okay, why not? Let's just add audit to the list. Why not? So just do your best to get things right first time if you can. That would be my advice.
yeah.
Um, any other questions? No questions. Bashir, have you got anything else to add? That's been very useful, actually. It's one of the most useful
Well, thank you
sessions.
so much. I have a suggestion. I have a question to you. Now, I'm working in an eye hospital for last 10 years. There is no consultant jobs here, but I got selected in substantive consultant post now.
Elsewhere.
Elsewhere, it's a 1.5 hour drive. Uh, um, 1 hour 20-minute drive. Should I go
I,
or should I?
1.5 hour, it's a lot. I mean, every day, 1.5 hour back and forth. That's like, I wouldn't do it. I mean, it's tricky, and you cannot
One
move,
hour
can you?
20 minute, yeah.
And you cannot move. House.
Well, I can, but that's a very small place. So
Tricky. That's always sort of advised that people should not sort of buy houses and stuff before they get a consultant post, because it'll be very tricky to move at that point, and children and your family and stuff just gets more
what about
tricky.
if what about if there is another job coming in 1 hour drive place? 1 hour is fine.
I think 1 hour is fine. I mean, in
Mhm.
London, I used to commute 1 hour every day. 1 hour is fine. More than that
1
is
hour.
a bit tricky. It depends on your situation, obviously, but and in Manchester they don't have any vacancies for medical retina. It's a bit odd. I mean, medical retina is always needed everywhere.
Well, that's the situation, but nowadays the situation in NHS is
Yeah.
there is no jobs. Most of the trusts are deficit.
I take the 1 hour one. It depends on the hospital, obviously, but I'd go for the 1 hour one and then see. I mean, you can always move again, but if you wish, but it's just
Yeah.
tricky. You have to think about long term. It's not easy. 1 hour back and forth is not easy, especially if you're on call and stuff. It's not easy at all. Ash, they've got your hand up.
Hi, thank you so much. I just wanted to ask Dr. Bashir about temporal artery biopsies he just told, because now recently there is less and less temporal artery biopsies, so opportunities are very limited. Mostly they are doing ultrasounds. So how do you get it? Because in our hospital, it is done by the vascular surgeons. So it's very difficult. And even then they say that, oh, the opportunities are very less. So
So
how did
I'm fortunate to work in Manchester Royal Eye. So here there is one dedicated specialist nurse who does the temporal artery biopsies on patients.
Oh,
And
nurse.
here,
Interesting.
so not done by consultant, it's done by a specialist nurse.
Interesting.
And that nurse is on the Royal College. He's a Royal College assessor. So he signed off for me.
So let me again answer this question. Now again they're a bit more flexible. All right. So again, for those who attended the recent sort of training days at the college, now it's not necessary to submit two. Okay. Ideally, it should be one, only one. The other one could be a CBD or a reflection or a referral letter. You refer to rheumatology or something. So things are becoming easier. Let's say again, back to the original sort of rule, that if your application is great and if you have not submitted any tab case, I think that'll be fine. All right. It depends on your situation, but now things are becoming more easier. Salim?
there any, sorry to
Yeah.
interrupt, are there any opportunities in simulation where we can?
I think so. I mean, I'm not aware. Is there any other courses in the UK that do simulation for tab? I'm not sure. Maybe there is, maybe a cadaver course or something. I'm not sure, but if there is, it should be fine. All right. People are aware that not many units do tabs now, so I think it's one of those things that would be okay. Okay, it's not a very very essential thing. Yeah.
Thank you so much.
Oh, I think I left one section. Just a minute. There were three more things. One was on electrophysiology, one CPD, PI7, two CPDs for electrophysiology. There were also one on aqueous and vitreous sampling.
Oh, so you haven't done a tap and inject?
Yeah. PS, one job showing ability to perform AC sampling, aqueous and vitreous sampling. So AC sampling. I did vitreous sampling. I didn't submit the AC sampling. So they said AC sampling.
Tell me more about the electrophysiology. Did they specifically ask you to interpret
No.
the
Yeah.
the to
No,
interpret?
they did two CPDs.
just to discuss it or request it or something
Yeah.
like that.
CBD will discuss with the consultant.
Because one of the previous candidates, they told me that they specifically asked her to interpret it as well. So that was a bit tough, because we just request it and then, we just read the report. But to interpret the actual graph, I think it's too much. So that goes back to the fact that it depends on the assessor. So if the assessor is tough, you will struggle, unfortunately. Salim, you've got your hand up. Have you still got a question? Yeah.
Yes, my question is to Bilal. So Bilal, you mentioned that you have got a dedicated temporal artery biopsy clinic run by a nurse. So do
Yeah.
they allow, on a request, do they allow any outsiders who do not work, like me, who do not work at Manchester Royal, to come and attend to get signed off, or is it tough too?
I think you need to get the honorary contract for that. Or
Okay.
I did honorary contract for you. I came to your trust with the honorary contract.
So what is the procedure? How is it?
For
What
honorary
did you
contract,
do?
you have to speak to your line manager. They will speak to and then you have to speak to the consultant here. They're happy to accept you, and then I think the HR team have to initiate the process for the honorary contract.
This is very common, by the way. So lots of people have to do it, especially for CESR. I haven't heard
Caesar,
of
yeah.
someone, not for CESR, but usually people have
Yeah.
to do it in that basis if you're
And
close enough.
But you have to initiate the process from your HR team, and then you have to speak to the person who is doing the procedure. If he is happy to accept, then he will speak to their, like our trust HR team, and then both HR teams will
agree, mutually agree.
and yeah, there will be mutual agreement. Then you will have to adjust your
Timetable.
timetable and schedule
Right.
to align with his theater. I think his theater, you have to ask about on which days he do theaters.
Got you. And
Yeah.
roughly, I know it's there's no hard and
Once a
fast.
week, probably once every 2 week. Not every. It's not very common, to be honest, but it's once every 2 week there are temporal biopsies.
Once every 2 weeks. And
Yeah, every 2 weeks, average. I'm telling you. Maybe
uh,
sometimes I was struggling. To be honest, I was struggling. I myself was struggling because there were trainees and other people were
yeah,
there.
everyone wants it. Everyone wants it. Yeah, I know.
I
Yeah.
think
So
Bashir will regret now saying this in public, because now all of the group will sort of start texting you now asking for the
I mean,
contact
this is
of
the
the
way you can do
specialist
it.
nurse.
That's what you have to do. There is a way called honorary contract. You do it honorary contract.
Honorary contract. Well, thank you both, Mustafa and Bilal. This was very
Thank you.
useful, and I'll stay in touch. Thank you.
That's a
Thank you.
pleasure. If no one else has got any other questions, I think because we've run out of time. Thank you very much, Bilal. Thank you very much. Thank you very much, Bashir. It's been very useful, and I will post the recording on YouTube very shortly. All right. All the
Thank
best
you.
in your consultant job hunt. Yeah. Good luck.
Thank you for calling me. Thank you.
All the best. All the best. Take care.
Thank you.
Bye now.
Bye.
Thank you.
No worries.